Okay, welcome back. This is part 2 for the ophthalmology itself. Okay, so we did speak about the retina itself, and that's where the receptors will be perceiving different signals from the outside source. If it's objects, colors, whatever we perceive. Okay, so we have a point over here. This is called, the yellow structure over here, it's called the optic nerve. And again, this is just a cut section right there, which is right there. It's a cable that's carrying the optic nerve itself, or the vision. So it's clearing off whatever receptors we have from the retina itself into the optic nerve. And it's kind of really interesting that we have retinal artery and retinal vein. So the vein is the blue one and the red is the artery. And they're passing within the optic nerve itself. And keep in mind that we have no vision receptors right there, so we would call this the blind spots, because we can't perceive any signals. It just collects signals from the surrounding area. Now the purple structure right here, this is called the fovea centralis. Fovea centralis. Right there. And sometimes they would refer to it as the yellow spot and fovea centralis. Okay, now keep in mind, surrounding the fovea centralis, we have a region right there, a region, and this region is called the macula itself. So keep in mind that the fovea centralis, that's where the cones will be clustering in this region in high quantities. And as we all know, that cones are responsible for color vision. Alright, so that should be it. So it's kind of really interesting that whenever somebody's watching, this is a board question, and it's very common on boards. A person or a 45-year-old male watching television, all of a sudden he lost vision. Okay, so most probably we're thinking from his history, if he has hypertension, hypercholesterolemia, or high levels of cholesterol, that, or previous history of DVT or blood clots, that the clot kind of traveled through the retinal artery and it kind of plugged this area right there. So as an emergency, okay, I don't want to, okay, try not to do this, try not to poke anybody, but still, as an emergency, what you try to do is that you try to poke slightly onto the cornea itself, or onto the eyeball itself. You're trying to dislodge the clot away from the retinal artery till you reach to the emergency room. Now, this is kind of theoretical. I'm not recommending everybody to do this, but it just could be multiple causes. It could be secondary to hemorrhage, and yada yada yada, according to these scenarios itself. Okay, now one more thing is that we have, this is the optic nerve, and it will meet the second optic nerve from the other eye onto something called the optic chiasm. Okay, now keep in mind that we have the master gland is called the pituitary glands. Now the pituitary glands will open up. Let me try to open this up. Okay. Now, the pituitary glands will lie within the sella turcica right there. Okay. Now, again, this is the optic, or the foramen, where the optic nerve will be coming up, and they will cross over or decussate, and they will form something called the optic chiasm. Now the sella turcica right there, that's where the pituitary gland would lie within. So if we do have a pituitary gland tumor, it will enlarge, and eventually that will press onto the optic chiasm. Now, what is the clinical, or what's the relationship with the eye or the vision itself? Well, if you do have a tumor that's arising from underneath, okay, so this is a different view right there. So if the tumor is arising from underneath, that will exert pressure right there. eventually that patient will be coming in complaining of something called bitemporal hemianopia. Bitemporal hemianopia means that they can't see peripheral vision, or vision that's off or away towards the temporal region itself. Okay, now let's get back onto our module here. Okay, other things we need to speak about will be the lacrimal sac. So this is called the lacrimal sac. Okay, we spoke about the bones itself. So again, this is the nasal bone. This is part of the frontal bone. This is part of the maxilla, and this is the cheekbone, which is the maxilla as well. Okay, so if we would just look towards the mid-sagittal view, or the mid-sagittal section, we could find that this is the frontal bone and this is a sinus. So we would call it the frontal sinus. Keep in mind that we have sinus or hollow or empty spots or space within the skull itself to enlighten and to make it light. Not too heavy, okay? Not to drop our heads, okay? All right, so this is called the perpendicular plate of the ethmoid bone. Or actually, I'm sorry, it's the perpendicular plate of sphenoid bone, because this is the sphenoid bone itself. Okay, so this is the sphenoid sinus. This is the sphenoid bone. And we have something called the crista galli right there. And we have kind of a fascia-like. It's called the cribriform fascia. So again, this is the crista galli right there, the bony protrusion. And the spots right there is called the cribriform fascia, or cribriform plate. And those protrusions, that's where the ophthalmologic nerves will be coming off from. It's called the olfactory nerves. Okay, I almost lost it for a second here. So those are the receptors that will be piercing through the bone into the fascia itself, and they will be passing along for the ophthalmologic and basically ophthalmic nerve, and that's our sense of smell. Okay, well, hopefully that this video will be helping you guys out, and wishing you the best. Please don't forget to like us on Facebook. Thank you. Actually, YouTube.